everybody, and welcome to our latest episode of VETchat. Today, I'm delighted to be joined by Amelia Sherwood, and we're going to be discussing fertility and conversations in veterinary practice. Amelia qualified as a veterinary nurse in 2012 and has worked in a variety of settings, both in clinical practice and within the veterinary industry. Whilst in practice, Amelia's roles included head nurse and consulting nurse lead roles, and more recently, she joined the veterinary instrumentation team as territory account manager for Southwest. Amelia holds a certificate in anaesthesia, is an OSCE examiner, an SQP assessor, and is nurse educator for the Belamos Foundation. During lockdown, she started an Instagram page called the Tissue Viability Vet Nurse to highlight the veterinary nurse's role in wound management and tissue viability, as she has a keen interest in wound management and improving clinical standards. So welcome, Amelia. Thank you for joining me today.
Thank you, Kathryn. It's lovely to be here.
So as you know, and as hopefully our listeners know, this podcast is very much here to try and raise awareness and to support women in the veterinary profession. And fertility is, I would say, the topic that we get asked to cover most. And we really appreciate you being here with us to share your experiences. So fertility can understandably be a very sensitive issue for people to discuss. And it's something that people, myself included, can often take for granted. You may decide that you want to fall pregnant, start a family, and you just expect that it'll happen straight away, when in reality, it can be very different. So let's start specifically looking at IVF and what it is and what it can involve.
Yes, yeah. So, I mean, I totally agree with you, what you said there, that I think a lot of the time is taken for granted. And, you know, I've certainly experienced that myself, being on both sides and, you know, being really fortunate to now have a family after our fertility journey. So, just to answer your question then, in terms of what IVF is and what it involves. So IVF stands for in vitro fertilization, and it's one of several techniques available to assist couples who have fertility problems when they are trying to conceive. Mm-hmm. So the process is different for many people depending on many factors. However, the initial investigations involve many investigative procedures on both parties, such as blood tests, laparoscopy procedures, and sperm samples, for example. So treatment will be dependent on the cause of the infertility, and it includes numerous ultrasound scans, hormone injections, egg removal surgery, and embryo transfer. So it's quite a lengthy procedure.
Yeah. Brill. Can you tell us a little bit about your story and how you kind of came to the point of deciding that you were going to start IVF?
Yeah. So my husband is 15, and we're very kind of excited and optimistic about starting a family. And as I'm sure many couples have that kind of thought process where they think, right, the wedding night tonight will be the night. And then, you know, a lot of our friends had children at that point, and, you know, I was definitely feeling quite broody, as they would say, you know, really ready to start a family. And months were sort of going by, and we just weren't catching. And I think initially it's a bit of a shock, especially those first couple of months, which are probably more heightened because you just expect it to happen naturally. I mean, you just think that that's what I'm supposed to do. I mean, I've spent all of these years trying to not get pregnant. Then suddenly, you know, when you expect it to happen and it's just not happening, you know, it was really quite an upsetting time. So a few sort of months passed by, and I started doing a bit of research, and then it got to, you know, 1 year elapsed, and we still hadn't conceived. And then you find yourself purchasing countless tests and downloading all of the apps, tracking your fertility, just trying to work out, right, well, what am I doing wrong?
Yeah.
And we then went to the GP to get some further information and advice, which was probably about 2 years in.
Wow.
So dependent on where you live depends on the services that your sort of local NHS board offer. And there's different time frames as to when you can have assistance, when your GP will intervene. So we started to have, I started to have blood tests initially just to check hormone levels. My husband went in for samples to be taken, sperm samples, for them to check motility and for any abnormalities. And then I was referred for laparoscopy, for further investigative procedures, just to find out exactly if there were any reasons that we weren't conceiving. And then that's when the process began then, really.
Okay, brilliant. So it was so about 2 years before you decided, right, this is the point where we need some additional support now.
Yeah, I think it was about 2 years in where we started to get medical assistance then, really. So I had been having conversations with my GP earlier on, because I think that, like most people I've spoken to that have been in a similar position, when you hit about a year, you really start worrying, and it does become quite concerning as to why you're not conceiving naturally. And I mean, when you really do some research into it, there's only such a small amount of days within a month that you are actually able to conceive. So I mean, it really is a miracle when people do conceive naturally so frequently. And then I think that to an extent took a bit of pressure off, realizing those kind of statistics. So yes, it was at that point then that we started to ask for some support from our GP then.
Yeah, brilliant. So then how long was your actual treatment once you started with the GP?
So I mean, it's different for everybody. We were really fortunate. So we started the investigative procedures. Obviously, this was pre-pandemic, so I'm aware that the times are a lot longer now, which is really unfortunate for families who are, really at that desperation point to get some fertility support.
Yeah.
And I had my laparoscopy surgery, where they essentially investigate if there are any issues that highlight why there would be any delays in conceiving. And then they decided, so they found that I had polycystic ovaries. So I had ovarian drilling during the procedure. And they removed some adhesions, which caused my issues for us as a couple. And then they decided actually it would be ideal to refer us for IVF at that point. So they deducted that our chances of conceiving naturally would be fairly low, as my husband, so I've had these conversations with him and he's more than happy for me to share this information, because I know it's quite an emotive subject. So my husband had some fertility issues as well. So between the both of us, they decided that it would be best to refer us for IVF.
Yeah.
So at that point, we were referred for IVF, and then we were quite fortunate that within probably about 6 months, they actually started the process. And we had numerous consultations with the fertility clinic at our local hospital, and then they decide the best route for each couple or each individual, and then start the actual IVF treatment. So we were, as I said, we were really fortunate. We conceived within a year, really, of our referral, which, is amazing, because I'm sure that a lot of people going through similar scenarios do quite a lot of research on the internet and read in forums and chat groups and see that there are so many people that have been going through the process for many years and still having difficulties. So again, it's very different to each individual and each couple, dependent on the findings from the investigative procedures and dependent on the route that they take thereafter.
Absolutely. Oh no, thank you for sharing that. Thank you to your husband as well for letting us.
Yes, oh bless him. I think he was also quite keen to have these discussions, because I mean it affects us as females in one way, but it affects males in a completely different way. And I think he felt like it was quite powerful to have these conversations and to share them. And so my husband's a builder, so you can imagine the stigma around it on sort of building site and between lads discussions. So he was really keen to have these conversations and bring them out in the open.
Brilliant. That's great. We'll have to get him on, do a follow-up.
Definitely. I think he'd love that.
So at the time when you were going through the treatment, where were you in your career? What role were you in at that point?
So at the time I was working for a local first opinion practice, and I was super fortunate that they were really really supportive with my circumstances. So I'm very much a talker, and I know that everybody is completely different in how they deal with their emotions and anything going on in their personal lives. And whilst I think we all, to an extent, try to not take our personal circumstances into work, I think when it's issues like this, it's inevitable for it to not affect you when you work in life. So the practice I was at the time were immensely supportive, and they were very much so. I had the conversation with the directors and kind of just put them into the picture of what we were going through. And they pretty much just said, look, just do what you need to do. And they were supportive in terms of appointments, and fortunately supporting me financially as well. So I was really lucky in that sense. And I think that it was really important for me to be able to have the conversations with my colleagues as well.
Yeah.
And
brilliant.
Just to be able to have those discussions with people around me, so they understood what stage I was at and why I might be acting in a certain way. And I think I've always been very career driven, but my career went through some peaks and troughs at that point, because it was quite a difficult time and my focuses were elsewhere. But then on the other hand, ironically, during the early stages, I threw myself into my work and my career just to have a focus. So I think it was really
distraction almost at the start.
So I think it was really important for people around me to have some kind of understanding what was going on, although everybody deals with things completely differently, and some people don't like to have these discussions and they find it quite difficult to do.
Yeah, absolutely. I mean, one of my best friends, went through IVF and didn't tell us until she got pregnant. She's the complete opposite of, it sounds like, how you approached the situation. She says now that she almost felt like she was putting more pressure on herself by openly saying what they were going through, and that's why she kind of chose to keep it so private. So everybody's different, I guess, aren't they?
Exactly. I think that's the thing, isn't it? And with every walk of life, everybody deals with things so differently to one another, and especially I think with fertility. So I totally understand where your friend is coming from in that perspective. And when we got really down to the nitty gritty and we were going through the egg transfer stages, I was a little bit more quiet about those times, I guess, because the pressure was really on them and I didn't want to put extra pressure on myself. But then I think that there's just generally a stigma around the word infertility alone, because that's what it is. And infertility is defined after a year or more of trying to conceive naturally without conceiving. So I think it can be quite frightening and have quite a big sort of psychological effect on people. And I think the topic of fertility treatment also seems to be quite a taboo subject in itself. whether it's due to a generalized lack of understanding or a fear causing unintentional upset to people.
Yeah.
And I found that some people can feel embarrassed to talk about it when in reality it's a medical issue and not a personal failure.
Mm-hmm.
And
Absolutely.
as we said, everybody deals with things differently. And I mean, when we started going through the investigative procedures, both my husband and I felt fairly alienated because, as I said, all of our sort of friends had young children, and it's just the expected thing when people sort of say, oh, now you're married, so when are you having children? And I think a lot of the time people don't think before they speak. It's just a natural question, a next kind of progressive step that people take. But those kind of things, they were quite difficult to process. So we decided quite early on that we were going to be really open about the discussions, because exactly for that reason, that we felt quite alienated. So we thought, well, surely we aren't alone. And some sort of interesting statistics came out of the appointments where the specialist had said that actually 1 in 7 couples in the UK actually go through fertility treatment. So, that's quite a high statistic when you think about the small amount of people that do have the discussions. And I mean, I guess you just don't know what's going on for people, and it's just good to have that awareness sometimes, isn't it?
Yeah, absolutely. And was that what made you want to come onto this podcast and to talk so openly about it, to raise that awareness?
Yeah, definitely. So I found as a vet nurse, so I've been, in the veterinary profession for 14 years. And as we all know, it's definitely a female dominated profession, with, I'm sure the last RCVS statistics were around 60% of vets are female and 97% of veterinary nurses are female. So it's inevitable that being in a female dominated industry that, it's going to impact quite a lot of us in veterinary practice. So I think it's really important to have these discussions and just raise awareness. So, I mean, based on those statistics, you can imagine that it's highly likely that there will be team members that are affected by it. And I think it can be such a sensitive subject. And again, people take things for granted sometimes and just don't think. And I know myself, when, for example, when we were in the early stages, before I had those conversations with my colleagues, that there's always somebody pregnant in a veterinary practice. I mean, it just seems to be that there's just constant maternity leaves and pregnancies. But again, because it's a female dominated profession, it's inevitable. So there was always those comments where people would say, oh, don't sit on that chair, you'll get pregnant, or don't drink the water in here, you'll get pregnant. And it's things like that that people just don't think of. And if somebody is going through that process, or even starting to have those feelings, I mean, even in the first 2 months, for me, that became really upsetting. And again, there's nothing malicious when people have those conversations. It's really just to raise awareness about what might be going on within the wider team.
Yeah, absolutely. It is such a female dominated profession, isn't it, as you say? And there must be so many people who are in a similar situation to you, who really struggle. We were saying just before we went live, September, you look on Instagram, your feed is covered with children going back to school and just things like that. You wouldn't necessarily, you'd post a picture, wouldn't think twice about it. But for some people, that post and even the month of September can be really difficult. So what kind of, I guess, advice would you give to somebody who, say, in veterinary practice, who might be about to go through IVF or is having a difficult time with their fertility? What advice would you suggest that they should take on board?
Again, I guess everybody's different in how they process their emotions. I mean, for me, I found it really empowering to do a bit of research and research in the right places. I mean, as we all know, working in the veterinary industry, that you need to make sure that you're consulting a reliable source to ensure that the information you're reading is accurate, because there's a lot of scaremongering that we can find online. So I think it was really empowering for me to do a bit of research and, again, to have those conversations with family and friends. But again, that's just down to my character. I'm just that kind of person who does feel better for having those discussions and knowing that people understand what's going on. I think that it was definitely important for me to have the discussions at least with management so that they were aware, because so much goes into the process. It takes its toll on you physically, mentally, emotionally, that it's nice to ensure that management have the understanding of why you might be off work, or you might just not be on your A game on a particular day, but also for them to understand that actually part of the medical process does mean that you will have the investigative procedures and it could affect you physically. And certainly after the egg transfer process, I mean, theoretically that would be classed as being a couple of weeks pregnant by that point, when you base it on a monthly cycle. So for me, very early on, the fertility team kind of advised that you should treat your body as if you are pregnant to that stage. So there's lots of risks, as we're aware of in veterinary practice, with pregnancy, and certainly early stage pregnancy. So it's just good to be aware of those things and take extra precaution when you're in practice. So things like being sensible around radiography and handling medications and lifting heavier dogs. And again, for me, it was just comforting to have my colleagues have a bit of an understanding. They didn't need to know specific dates. They didn't need to know exactly where I was within the process, but just to know to maybe be aware that if I needed a bit of extra support, that could be the reason why.
Yeah, absolutely. Brilliant. Thank you. We are out of time. That's flown by fast. Thank you again for being here, Amelia, and for sharing your experiences and all your advice as well.
I've thoroughly enjoyed, and my inbox is open, you know, on my Instagram page, if anybody wanted to drop me a message, if they don't feel comfortable having those conversations and just wanted, you know, somebody else to talk to, then I'd be more than happy.
Oh, that's brilliant. Thank you. That's great. And we'll make sure that the blog that goes live with this podcast has got a direct link to that as well, so people know exactly where to find it.
Wonderful.
October is Women's Health Month. I can get my words out there. So it's the perfect time for us to continue to raise awareness and to continue these conversations. So hopefully, as a profession, we can continue to improve all those who are, you know, affected. So thanks so much again, Amelia, for joining us.
Perfect. Thank you for having me on.
Take care.
Bye.
Bye.